ultrasound, which is free of radiations. The other one is the nuclear medicine, and the MRI, finally MRI. As far as the plain X-ray is concerned, these are the these are the applications of the plain film to rule out the renal calculi, to see emphysematous pyelonephritis, in which we can see gas bubbles on these plain scan. The size of the kidneys, we can well appreciate the sizes of the kidneys on the plain X-ray, as well as we can see a soft tissue shadow. Advantages are it's a very cheap procedure, readily available everywhere, and it's very fast. We can do it within like few minutes. Disadvantages, it's rarely diagnostic as there are lots of bowel shadows, fecalness within the bowel loops, which can mask the diagnosis, and we cannot appreciate the small calculi or if there is gas within the urinary system. This is a plain radiograph. You can well appreciate the renal shadows. These are the renal shadows. Here you can see the labeling is done, kidneys. This is the left kidney, this is the right kidney. You can well appreciate the sizes of the kidneys and their outline. So we can make out whether one kidney is hypertrophied or the other kidney is small or absent. We can have a rough idea about the kidneys on the plain X-ray. And we can also appreciate if there is any calcific density within these soft tissues. We can also appreciate it very well on KUB scan. These are the transverse processes of the vertebral bodies, and this is where the ureter is crossing. So we can have a rough idea if we found any calcific density in this line. We can have a suspicion that it might be a renal calculus, sorry, ureteric calculus. This is a source shadow. See, this is a plain radiograph showing a renal stone. This is where you see the renal shadow in the previous film. And this film, the bowel preparation is not very well done. So we can see a lot of bowel shadows, bowel gas, and the renal shadows are not very well appreciated. This is one of the disadvantages of the plain radiograph. This is another film showing a calculus. Here you can see this calculus is along the transverse process of this L4 lumbar vertebral body. So it is outside the shadow of the kidneys. This is the renal shadow. So possibly this calculus is within the ureter, as this is the landmark where the ureter crosses along the transverse processes of the vertebral bodies. Here you can see in this X-ray, the left one, there are multiple calculi within the kidneys, the small calculi, a large calculus within the renal pelvis. If it blocks the entire pelvis, we call it a staghorn calculus. These are the multiple calculi, staghorn calculus with multiple secondary calculi. And on left side, you can see a small oblong calculus along the transverse process of the L3 vertebral bodies. Possibly this is a ureteric calculus. So we have right kidney renal calculi and left ureteric calculus in this case. See, this is a case in which the entire kidney is calcified. This is the renal shadow, the entire kidney is calcified and dense. We cannot appreciate any calculus within the ureteric outline or within the renal pelvis. This is the entire parenchyma of the kidney, which is calcified and irregular. This is what happens in cases of the renal tuberculosis. The post-infectious diseases causes this calcification. This is the post-infection case of the renal tuberculosis, which is called putty kidney. That is the entire kidney is small and calcified. Now we come to the intravenous pyelogram. Intravenous pyelogram is a gold standard 20 years ago, but it is becoming obsolete because it has limited views of the kidney outlines, two-dimensional technique, and largely replaced by CT scan. Nowadays, we don't routinely use intravenous pyelogram for the screening of the ureteric calculi and so to see any renal pathology. We go for a CT scan, CT pyelogram. This is a conventional intravenous pyelogram. We give a contrast injection, which is excreted to the kidneys, and you can see the pelvic calyceal system and the ureters are beautifully outlined by the contrast in this case. These are the calyces, the pelvis, the ureter, and the contrast is well appreciated in the urinary bladder as well. Here you can see the outline of the ureter is along the transverse processes of the lumbovertebral body. Then it crosses the sacrum slightly medially, and then it opens into the urinary bladder at the uretrovesical junctions posteriorly. So what I've shown you on the plain radiograph, the calculi are over there along the transverse processes, so they were possibly within the ureters. But we can only raise the possibility. We cannot surely say that these are the ureteric calculi, as they might be the fecolith within the bowel loops. So the gold standard for the ureteric calculi nowadays is a CT pyelogram. See, this is another case of the pyelogram, intravenous pyelogram. The kidneys are excreting contrast. The pelvic calyceal system on the right side is slightly, here you can see there is a small arrow, the renal pelvis. This is the ureters, the stars, and this is the bladder. Right-sided system is slightly dilated as compared to the left-sided system, but we cannot appreciate any filling defect in this case. This is another case of intravenous pyelogram. Here you can see multiple dilated calyces in the right kidney. The pelvis and the ureter are not outlined on the right side. However, the left-sided system is absolutely normal in this case without evidence of any filling defect or dilatation. So this is a case in which probably there is obstruction at the level of the renal pelvis with markedly dilated calyces in this case. This is a plain radiograph, IVU. Here you can see a pelvic calyceal system, which is a very normal looking. On the left side, there is a heterogeneous mass on the left side at the side of the renal bed, and with multiple specks of air within it. So this was a case of emphysematous pyelonephritis. As I told you before, on plain film, an IVU, we can appreciate gas bubbles in the region of the renal pelvis. This is another case of intravenous pyelogram. Here you can see an indentation in the pelvic calyceal system, a very smooth indentation, smooth and regular. There is no evidence of any irregularity. This is a cyst within the kidney which is indenting the renal calyces, and we can well appreciate an extrinsic compression over the pelvic calyceal system. Here you can see this is another case with which is showing a normal flow of urine with a white arrow. These are the ureters, and this is showing a normal flow of the urine. However, you can see in the other case there is a calculus in the proximal ureter. So there is dilatation of the left-sided pelvic calyceal system just because of this proximal ureteric stone, and there is no flow of contrast with the ureter on left side in this case. So possibly this is a case of a ureteric calculus with obstruction and results moderate hydronephrosis on left side with a right-sided normal system. Now we come to the computed tomography. Computed tomography is the imaging modality of choice for most abnormalities. Advantages: it's fast, widely available, and it has a very high resolution when we can pick stones up to less than 3 millimeters, 2 millimeters, and even 1 millimeter stone. We can very well appreciate on the CT scan. Disadvantages are the high dose of radiations, IV contrast, and it is less specific than MRI as far as the soft tissues are concerned, not the calculi. This is an image of a CT scan. Here you can see the renal shadows, the gray. This is a scan with a contrast, CT scan with contrast. You can see the kidneys are looking much whiter as compared to the rest of the organs. This is because of the contrast enhancement. In the first phase, the parenchyma enhances. This is the nephrogram phase, which enhances the renal parenchyma. And after a few minutes, we took the pyelogram phase. The contrast started excreting from the parenchyma into the pelvic calyceal system. Here you can see these are calyces, and this is the pelvis, and this small dot is the ureter. So the contrast started excreting into the pelvic calyceal system. So this is a pyelogram. You don't need to know the exact timings, but you need to know the phases. There are two phases. The first is the nephrogram phase, in which we see the enhancement of the renal parenchyma. And the second phase is the pyelogram phase, in which we see the contrast within the pelvic calyceal system. So that if there is any filling defect, we can well appreciate on the pyelogram phase. Even if there is any mass within the pelvic calyceal system, like transitional cell carcinoma or any blood clots, they are well appreciated on this pyelogram phase. If there is any mass within the renal parenchyma, so we can well appreciate it on nephrogram phase. Okay, you just need to know what is the nephrogram phase and what is pyelogram phase. That's it. Nephrogram phase is the enhancement of the parenchyma to rule out any parenchymal abnormality, and the pyelogram phase is for the pelvic calyceal to rule out any abnormality within the pelvic calyceal system. Okay, this is the normal anatomy of the kidney. You must have all learned it, as this is your last class of this session. You're already, I think, done with the anatomy and the pathology, so I'll not go in detail of this anatomy. We'll focus more on the imaging. Here you can see this is a case in which there is a staghorn calculus. Staghorn calculus is a calculus which obstructs the entire pelvis as well as the calyces. So it blocked the entire system. You cannot appreciate dilatation in such cases, or there is focal dilatation of the calyces. In this case, you can see a calculus in the pelvis, the calyces, as well as the proximal ureter. The entire area is calcified and packed with the calculi, that is the staghorn. These are, again, you can see small renal calculi. I was telling you the CT scan is very sensitive in detecting small calculi as well. These are the tiny calculi, 1 millimeter calculi. This is a 2 millimeter calculus in the left kidney. They can easily be missed on ultrasound, on IVU, and even on the plain films. But CT can pick a calculi up to 1 to 2 millimeters very easily. This is another case in which the CT scan is showing a large staghorn calculus within the renal pelvis, dilatation of the upper and the lower pole calyces. There is also associated enlargement of the left kidney due to edema and the mass of the dilated calyces. Here you can see the ureteric calculi at two different levels. In this case, you can see this is the urinary bladder, which is filled with urine. And here you can see a small white dot. The calculi appears white. They are dense white. These are the bones, acetabulum and the head of the femur. You can see these are also white. Any calcific density seen on CT scan as well as on X-ray, on IVU, they appears white, dense, just like bone. Anything which contains calcium appears white. So you can see an unusual white dot here adjacent to the urinary bladder on right side. This is a calculus within the right ureter, just near the uretrovesical junction. This is another case on right side, a small white density you can see on CT scan anterior to the psoas muscle. This is a ureteric calculus in the left ureter in its mid part. This is the distal ureter as it is close to the urinary bladder, as this is near the lumbar vertebrae, so this is the mid ureter. Another calculus, you can see it is at the uretrovesical junction. This is the junction. This is the bladder. It's just seen at the bladder wall. However, it is not protruding inside the bladder wall, so it is at the uretrovesical junction. Now the bladder scan, here you can see this is the normal urinary bladder, well appreciated on the CT scan. These are the acetabuli, head of the femur. This is the axial scan. Posteriorly, you can see a rectum. Here you can see multiple calculi with the bladder as the patient is in lying position. CT scan is done in lying position, so you usually see calculi in the dependent part of the bladder. This is the dependent part. The posterior part of the bladder is dependent when the patient is in lying position. So you see multiple calculi, bladder calculi in its dependent part. This is another case of a bladder calculus. You can see a small high density seen in the dependent part of the urinary bladder. So these are the reconstructed images of a contrasted scan CT scan. Here you can see, as I told you before, that on CT scan, we can also see other parenchymal abnormalities of kidneys. This is the left kidney, white, on a nephrogram phase. Nephrogram phase means in which the parenchyma is enhanced by the contrast. So this is the normal kidney, which is seen white, showing normal enhancement. And this is the, sorry, left kidney. And this is the right kidney. You can see there is no normal parenchyma, but instead you can see multiple rounded black structures. These are cysts. This is the multicystic dysplastic kidney. The entire parenchyma is replaced by the cyst of variable sizes, and it is unilateral. This is a typical appearance of a multicystic dysplastic kidney. Why this is not polycystic kidney? Polycystic kidney disease is usually bilateral. However, if you see a unilateral disease with a multiple cyst of variable sizes, so this is multicystic dysplastic kidney. The multicystic dysplastic kidney can be a sequel of any renal pathology. This is another case. You can see this is the right kidney. This is a nephrogram phase, okay? Because you can see enhancing kidneys. The right kidney is normal, showing homogeneous enhancement. When you see a left kidney, the left kidney is large, bulky, and you see the enhancement is very inhomogeneous. You see multiple hypodense areas within the kidney, the low areas. It's not purely white, as you can see the right kidney showing normal enhancement and the left kidney showing patchy enhancement, patchy white and patchy gray areas. This is a large kidney with patchy enhancement, is a case of a pyelonephritis. So this is an end, students. If you have any query or any question, you can ask.